Hello everyone, I'm Dr. Peggy Linguist, Medical Director of Hope Clinic in Ellis County. I know that your life has probably changed dramatically in the last few weeks, as has mine, as our country has faced the coronavirus pandemic together. I wanted to share with you a few things that Hope is doing to help keep you and your family safe during this time. First off, we're offering virtual visits. These visits can be either by phone or by video chat with a provider. And you may not even have to leave the comfort of your own home. You can call our central number, 972-923-2440, to set up an appointment with a provider. Together, you and a provider will decide whether you need to be seen in person or if your problem can be treated over the phone. The great news is that most insurances are paying for those virtual visits at this time. So that's an option that's available for everyone who's a Hope Clinic patient. Secondly, we're also seeing people in person in the clinic. I want you to know that our lights are still on, our clinicians are still there, our doors are still open. When you come to the clinic, it might look a little different. First off, we're not going to hug you or shake your hand, and we apologize about that. You're going to check in at the tent in the parking lot. We'll take your temperature. We might even ask you to put a mask over your face. When you see our Hope family, they're going to look a little different too. They'll be wearing masks, some will be wearing face shields, gloves, and gowns. We want you to know that underneath all of that personal protective equipment, it's just us, and we're still here ready to love and serve you. Another thing that we've done to change to help keep things safe for you and your family is that we're mostly offering only well visits to people who come to the clinic, especially in the mornings. All mornings are for only well patients, so that you can feel reassured when you bring your child, when you bring your pregnant wife, when you bring your elderly grandmother. They're not going to be exposed to other people who could be sick. They'll only be exposed to well people. So I also want you to know that our behavioral health staff is still up and running. They're doing all virtual visits and they're here for you. Unfortunately, we've had to close our dental department for now, and we're waiting to reopen as soon as we hear from the state. One thing that we're offering in addition are our support groups. Because it can be so isolating to be at home and socially distanced from others, next week we're going to start offering support groups for all different types of situations. You might be a mom with an infant at home. You may be a family who's trying to homeschool a child with ADHD. You may be somebody who already struggles with anxiety or depression and you need just a little extra support. And the good news is we're here for you, and those support groups will start next week. I want to reassure you that we're following the CDC guidelines, even as they change quickly. We're also part of a coalition of community health centers in the state of Texas, and we've been able to share ideas and procure equipment and supplies through that coalition. So together, we're all working to help keep you and your family safe. So for now, if you have questions, please don't hesitate to reach out to me or to Barbara Clark, our Chief Executive Officer. You can reach us at our same Hope Clinic number, 972-923-2440. I want to thank you for being a part of the Hope community. And for now, please stay safe and be well.